Hello, my name is Cameron Block. I'm 19 years old, and I was diagnosed with Leigh-Fraumeni syndrome in March of 2015, though my journey began over a year before that. I was 14 years old and having persistent knee pain and swelling that were preventing me from exercising and sitting normally. We made an appointment in December of 2013 to see my orthopedic doctor, where he took an x-ray of my leg. He discovered a 7-centimeter tumor right above my left knee and immediately scheduled me for a biopsy the next day. About a week after the biopsy, the results were confirmed by both the hospital and Mayo Clinic. I had telangiectatic osteosarcoma. Now, the week after was a whirlwind of different doctors and hospital visits, and after much prayer and consideration, we chose my amazing oncologist at UCLA, Dr. Noah Fetterman, and the equally amazing orthopedic surgeon who did my surgery, Dr. Susan Bukata. On January 3rd, 2014, I had a port placed in my chest and I began treatment that night. Treatment consisted of 2 rounds of aggressive high-dose chemotherapy, followed by a surgery to remove the tumor in the surrounding muscle and replace a portion of my left distal femur and my entire knee joint with a metal prosthesis. Afterwards, it was just about 6 more rounds of that same chemo to finish it all off. Now, a few weeks before my surgery, my oncologist approached my parents and asked if we were willing to participate in a genetic study he was doing, since my type of tumor was so rare, accounting for only about 3% of all osteosarcomas. Since we were so grateful for everything he was doing for me, we agreed. But little did we know what the results would later show. Now, the rest of my treatment after my surgery went pretty smoothly. By the grace of God, my tumor had responded very well to treatment with a 99% necrosis. Plus, I had a shiny new titanium knee and an awesome 14-inch scar to show for it, so. I recovered quickly from surgery and successfully transitioned from doing inpatient chemo to outpatient chemo for the remainder of treatment. I finished on schedule in August of 2014 and was on the road to recovery. In March of 2015, I was scheduled for a routine appointment with my oncologist. It had been about a year since he had first told us about his study, and we hadn't heard anything about it since, so we asked about it at that appointment. It was then when he told us that they discovered that I had a mutated TP53 gene, and after many more questions and pressing for more information, I was referred to a geneticist at UCLA, where I was finally told that I had Leigh-Fraumeni syndrome. Neither of my parents had it. It was de novo. It was then when all of the possible consequences of having LFS hit me like a truck, including the fact that LFS was the reason that I had gotten cancer in the first place. I was afraid that this meant I wouldn't be able to move on with my life, with the threat of cancer always looming over my head. But I continued to remain positive. My family and I had never listened to odds or percentages in the past, and we most certainly weren't going to now. I knew that God was going to use all of this for something good. The fact that I'm here right now, I think, is a testament to that. Now, about a year after I was diagnosed with LFS, my parents were continuing to search for more information and for a geneticist who would be a better fit for me, and they discovered Dr. Josh Schiffman at Huntsman Cancer Institute in Salt Lake City. He has brought a lot of hope to my family, and I couldn't talk about my LFS without mentioning him, so thanks, Dr. Josh. Now, since we found out I had LFS 3 years ago, we have discovered through the Toronto Protocol that I have 1 small brain tumor, which is currently stable and unchanged, 2 thyroid nodules, which are benign and stable, and 1 liver tumor, which was benign and removed last year. And I'm so thankful that I haven't had any cancer since, and we will continue to celebrate life amongst any bumps and lumps that may appear along the way. Now, for me, a big part of living with LFS and having the knowledge of my increased risk of cancer is keeping a positive attitude. Before chemo had started, I had been told by my doctors, in their effort to try to prepare me honestly for what was ahead, that it was going to be the, quote, worst year of my life. But, and I'm not exaggerating in the slightest, the year that I had cancer turned out to be one of the best years of my life. A huge part of my fight with cancer was my family. My mom, dad, and sister were my biggest cheerleaders and teammates during my treatment, and were there every single day I was in the hospital for chemo. I finished my freshman year on time from my parents motivating me to get my schoolwork done in the hospital every single day. And because of all the time we spent together in the hospital, we grew so much closer together as a family. I also passed time visiting teens staying in the rooms next to me, just talking and relating to each other about life and the side effects of chemo and surgery. And a few of these patients are actually still my friends to this day. And while I lost a bunch of other friends that turned out not to really be my friends at all, I gained a few really close friendships that couldn't have happened had I not lost all of the other ones. So What I'm trying to say is that nothing and no one can dictate whether you will have the worst year of your life. It is completely up to you on how you choose to see the situation you're in. I wholeheartedly agree with the phrase that God never wastes a hurt. I've seen it come true multiple times in the past couple of years, and I believe it's coming true again right now, right here.
You're terrific. Good morning.
Good morning.
My name is Jamie Higgins. I'm 60 years old. I live in Athens, Pennsylvania. I'm the grandfather of 10, and I have Lee-Fraumeni syndrome. And this is my journey. In 1995, my daughter Kerry was diagnosed with an osteosarcoma in her right leg. At the time, we had never heard of Lee-Fraumeni syndrome. I'm guessing most of her doctors hadn't either. Well, after endless rounds of chemo and about a dozen surgeries, she was finally deemed cancer-free. She had a titanium thigh bone and a plastic knee, but she was alive. And then in August of 2002, our daughter Maureen went away to college. She came home for a visit that October. Something just wasn't right. She was thin as a rail and she was gray as a ghost. She had an adrenocortical carcinoma, and it was already stage 4 when they found it. The cancer was aggressive and it was merciless. She was skin and bone when the end finally came in March of 2003. Well, it was right after that time that they started putting 2 and 2 together, and Kerry was interviewed about her own cancer from '95, and they asked her about a family history. Well, as it turned out, my father had died of a brain tumor in 1966 at age 37, and my sister had suffered through 3 separate cancers, finally succumbing in 1993 at 32. Again, back then we had no clue. We just thought we were extremely unlucky. We used to joke in that gallows humor kind of way that this was our family curse. So Kerry was genetically tested, and yes, it came back positive for LFS. In 2005, she received a prophylactic double mastectomy because they found some precancerous cells in her milk ducts. Well, the doctors took the baby early, but by then it was too late for her, and during her pregnancy in 2011. And we lost her 2 days into 2014 when she was only 30 years old. If there was any kind of a bright side to this, it would have to be that her 2 daughters are negative. Because Kerry had the foresight to have her eggs harvested and tested, only having healthy eggs implanted. Knowledge is power. Well, as you can imagine, at this point, Kathy and I, Kathy's my wife, we were just numb with grief. And I had a serious case of survivor's guilt, as did my one remaining biological child, Eileen, who happens to be Maureen's twin. She tested negative. And here I was already 57 years old, and I had never presented. Well, my own luck finally ran out that fall. And within a year, I was visited by 2 separate soft tissue sarcomas, one under my right arm, one in my right thigh. Identical histologies, but both classified as primary cancers. And while both were initially misdiagnosed by my local hospital, Dr. Judy Garber and all the amazing people up at Dana-Farber, Brigham and Women's in Boston, they rode to the rescue both times. And they've been keeping me happy and healthy ever since. Yeah, I may be a sight in my bathing suit, like some fat old scarecrow all sewn together. But I see my scars as an opportunity to educate people about LFS and a chance to talk about my girls. When our daughter Maureen, Mo we called her, passed away in 2003. Kathy started an internet business making funeral and memorial cards. Time out. She's never made a ton of money at it, but that's not why she does it. She's always gotten great satisfaction out of helping people navigate through what can be a very overwhelming and painful period after losing a loved one. And when Kerry, who was Kathy's partner in that business, died, she started an annual charity event in our local community called Mo Songs for Kerry, and that's now in its 5th year. And when we were looking around for a place to donate the money that we were raising, she discovered LFSA. Well, she started volunteering for them, and now she's one of those people that goes around to the trade shows and the conferences, setting up a table and buttonholing passersby, trying to get the word out about the disease and the organization. The point I'm trying to make here in this roundabout kind of way is that Kathy had the ability to step outside herself, to harness her own grief and turn it into a motivating factor. She's always found solace and purpose in helping other people. You know, Mahatma Gandhi once said, the best way to find yourself is to lose yourself in the service of others. The 2017 LFSA Impact Report was entitled Game Changers. LFSA itself was founded and is run by individuals who looked out there and saw a hidden community of disconnected individuals, people whose situations and experiences were similar to their own. And they set about trying to bring them together to accomplish something for a greater good. Now, these are just ordinary people doing extraordinary things, and they all have one thing in common. Each one of them made a decision to look beyond themselves and make a positive impact in someone else's life, to be a game changer. And while I'm sure that none of them would consider themselves to be a hero, well, to me, their personal sacrifice and selfless dedication to the fight for our common cause, well, that's the very definition of heroism.
Of course, not everyone can realistically aspire to such lofty aims and efforts, but that doesn't mean that the rest of us can't make a meaningful contribution of our own. There are a myriad of ways to help make a difference, whether it's organizing a charity walk or other event, volunteering on a committee, lobbying for the cause with our elected officials, or how about something like setting up a local support network where LFS families near you can share their stories and their hopes and pain and lean on each other in times of crisis. Maybe we can get together for a dinner or a barbecue once in a while. Or you could distribute informational pamphlets to hospitals and clinics in your area. So today we're issuing a challenge. As our 4th International Symposium progresses through the week, while you're taking in all the presentations, enjoying the planned events, and rubbing elbows with all the good people, the doctors, nurses, clinicians, researchers, geneticists, students, and, of course, other LFS families, think about how you might possibly make an impact, large or small. Education, awareness, support. Like I said, there are many ways to make a difference. Perhaps you could give a motivational talk at a conference like this one sometime. You'll know when it hits you, when an idea piques your interest and aligns with your ability and availability, and you say to yourself, "Self, I believe we can do this."
And in helping others, you're going to be helping yourselves. We're all going to benefit, because although we may have taken different paths to get where we are today, the reality is our scars are no different than your scars. Your pain and loss mirrors ours, and in the end, we're one community with shared hopes and goals. It's important to remember that we're stronger together. It takes 5 fingers to make a fist. And while it may be human nature to romanticize about the past, to choose to remember those brave faces and valiant struggles of those we've lost, the cold hard truth is that none of that prevented them from ultimately becoming victims of this insidious disease. So it falls to us, those of us still standing, to step into the breach and to take up the battle. We owe it to them. We owe it to us. So look beyond yourselves. Be a game changer. Don't be intimidated. You can do this. We can do this. There's a little bit of hero in all of us. Thank you.